Hi, I'm Dr. Schiller. This video might be useful if you or someone you love is continuing to suffer from chronic pain or chronic illness despite or maybe because of the best conventional medical care. I want to tell you about my approach and why you might want to work together. I see people in person in Jerusalem, Beit Shemesh, Gush Etzion, and by telemedicine in many U.S. states and worldwide. My integrative medicine practice is about helping people recover from catastrophic or serious illness or injury and problems like chronic pain, fibromyalgia, fatigue, weakness, difficulty moving around, autoimmune disease, post-COVID syndrome, and other disabling conditions. So God willing, I help people feel better through a level-headed integration of conventional scientific understanding and natural healing, and perhaps most important, helping people mobilize their own inner capacity for self-healing. I want to share two reasons why conventional medicine often misses the mark in chronic problems and how my practice is different than that. So first, a little bit of background. I studied engineering and medicine at MIT and Duke University and Harvard Medical School and got huge academic training. But all of my free time for the past 30 years have been spent studying mind, body, spirit medicine and natural healing and osteopathy, nutrition, movement arts, and other aspects of mobilizing the body and mind's natural healing capacity. I've had roughly 40,000 patient encounters over the last 20 years or so, and putting all of that together, I've synthesized a way of practicing integrative medicine that often helps where conventional medicine doesn't. So training and working in some of the best hospitals in America, I witnessed two core issues, which I think are part of why conventional medicine often misses the mark in dealing with chronic and difficult to treat problems. The first is that most docs work in a system where they don't have enough time or even interest to think comprehensively about the issue, and they're obliged to break things into one problem at a time. And what you really need is someone to look at the big picture and understand how it all fits together. The second problem is that the conceptual framework, the basic understanding that we get indoctrinated in medical school is great for dealing with emergencies, where there's one specific problem that needs one solution and can be fixed. But it's not so useful in more complex problems, which tend to be multifactorial, meaning lots of different factors are contributing to your suffering. And so conventional docs are rewarded for quickly putting you into a diagnostic box, here is the problem, and giving a fairly simplistic solution, rather than looking at all of the different variables that are contributing to your suffering and coming up with a meaningful, integrative approach for addressing the whole picture. And of course, this does not apply to everybody. There's a lot of amazing practitioners who are doing wonderful things. And I'm not criticizing individual doctors. I'm just saying that there's a bias in conventional medicine towards short visits, towards an oversimplified approach. And when the problems are complex and multifactorial, that just doesn't work that well. In contrast, I learned to take an integrative approach, to acknowledge that you are one complete integrated system with a deep integrity and healing capacity within you. I look to understand the core biological imbalances that are giving rise to your suffering from the latest scientific understanding, as well as with potent perspectives from natural healing, which tends to be more holistic already, and to come up with an understanding that really actually captures the whole picture. And then to take that understanding and with you, according to your values, come up with a treatment plan that makes sense for you and that addresses sort of the whole picture of what's causing your suffering so that we actually find a meaningful solution. So if this is interesting to you, I suggest you get more information. One pathway is to reach out to my office at drschiller.com/scheduling, or just go to the website and complete the contact form and reach out to my assistant. And if you're not ready to make an appointment yet, you can also just look for my stuff on Facebook and YouTube and my blog. Another big part of what I do is training for people who are dealing with difficult circumstances with chronic pain and illness, to mobilize their inner healing capacity, to actually give them the skills to cope more effectively and potentially change the course of their chronic problems. and also training for healthcare providers who are providing service, who are learning to practice with as much therapeutic potency and presence as they can, who want to understand the depth of integrative medicine. So I hope this has been interesting and fun. If you like this video and it speaks to you, please share it with whoever you think might benefit from seeing it. And looking forward to hearing from you.